Hello there, this is John speaking, your instructor. Just wanted to do this little video on how to place EKG electrodes onto a patient. You might get a chance to do this during your clinical experience time at the hospital. If you work with a paramedic out in the field, either on a fire engine or an ambulance, you're going to do it a lot, like every single day. So it's a good idea to at least get started to get an idea what it's like. So you're going to have an EKG device like I have over here. It's going to be hooked up and you're going to have these 4 leads. Most EKG devices nowadays are 4 limb leads. If I can untangle my limb leads here. There are some machines that are still 3 lead. The actual application is not any different, same idea. So this machine has 4 leads, which is again most common. You have the right arm lead, you have the left arm lead, the left leg, and the right leg lead. They're color-coded: green, black, white, and red. Pretty straightforward. You also have these electrodes, the actual part that sticks onto the patient. They come in a package, different 5, 10 to a package, whatever it might be. The idea, we like to snap these onto the electrodes first and then apply the electrode and the wire to the patient. If you apply the electrode sticky part to the patient first, you have to push in to snap it onto the patient. It's rather painful, uncomfortable for the patient. This is so when you're getting ready to apply this to a patient, this is what it should kind of look like, ready to go, ready to apply. Prior to application, what I like to do, and I highly recommend if you have time to do it, is you want to get just a regular old dry 4x4, and you know roughly where these are going to go. Just kind of wipe the skin. All you're doing is you're removing the excess oils and some dead skin cells and making a better contact. Throw it out of the way. And then with the patient's permission, of course, you're going to apply the leads. So this is the white lead, so it goes in the upper right side. You can just put it onto just right below the clavicle. So kind of the soft part of the tissue right here. And then make sure it's nice and sticky. It's on there. Then you're going to do the black lead, which is the left arm. And again, these can go on to the actual arm, the back of the hand, and all that. But again, there's increased artifact in our particular environment. So we got right arm, left arm, and then we're going to go with left leg, which is the red lead. It says LL, so it's pretty straightforward. And again, this should be right above the belly, or right above like the belt line. Be a good place to put it, in that soft area of skin. And then again, we'll do the right leg over here. So this is what it would look like. This would provide a non-diagnostic view of the patient's heart. A medic or a doctor or a nurse can monitor the heart for abnormalities. It's non-diagnostic, which means that it doesn't give the best view, but it's enough to give us an idea of what something might be going on with this. If you're working with a paramedic and you have a patient who had a fainting spell or someone who's overdosed on medications that might affect the heart, the monitor is going to want to be on this patient so that the medic can keep an eye on the patient's heart to see if there's any changes en route to the hospital. So it's a really simple process with this. Wiping down helps a lot. Applying the stickers helps a lot and all that. Making sure they're firmly applied anyway. If the doctor or nurse or medic wants a diagnostic view of the heart, they'll have you do a 12-lead EKG. So this is an additional wire that comes with the EKG device. It actually plugs in to the other 4 leads. There's actually a little plug-in port right here. I won't actually do it right now, but it plugs in right there. And you have 6 they're called V leads, V1 through 6, and they're labeled V1 through 6. See, the red one it says V1 all the way up to V6. These go on the torso right here. So we have to kind of feel for the anatomical positions and where these things should go, because they need to go in pretty accurately placed to get a good, accurate reading of what's going on. So we use the intercostal spaces. The intercostal spaces are the spaces between the ribs. So if you go to the right clavicle up here, the collarbone, and you slide your finger down into the first notch, that's your first intercostal space. Run your finger over the second rib, and then there's your second intercostal space, and then your third intercostal space, and you go all the way down, you find your fourth intercostal space. You can kind of feel the indentation there. You want to put your V1 lead right there. So you find the red V1 lead, and you take off the sticker, of course. We can get this to happen here. And this would go to the right of the sternum and the fourth intercostal space. We're going to mirror that with V2. So V2 is the yellow. It says V2 on it. Pretty straightforward. It's not rocket science, I got to tell you. On to the left of the sternum, again, fourth intercostal space, you're going to place V2. Make sure they're nice and snug against the skin. You've prepped the skin. You wipe the skin down like we talked about earlier. Now we're going to kind of jump over a little bit. We want to place these accurately. So we're gonna this is the fourth intercostal space. This is the fifth intercostal space. And then right down here is the sixth intercostal space. And we want to align it with the middle of the clavicle. So right about here, little bit to the right of the nipple line here, you're going to place the V4 lead. V4 lead. It's hiding from me. Yeah, V4 lead. Look at that, huh? V4 lead. So this is going to go right about here. And this is your sixth intercostal space. And then we're going to back up, and we're going to put on the V3 lead in between the 2 and the 4. And this ensures that this lead is placed accurately. Get the stickers off here. Come on. Don't be mean. Let's try another one here. We have an electrode malfunction, so I got to get another electrode and try it again here. Okay. Hey, look at that. It works. And then we're going to place this one right about here. So now we have 1, 2, 3, 4. And then all I have to do now is follow that sixth rib back. So anterior axillary and then mid-axillary. So then 5 goes anterior axillary. So right about here. And then the sixth one, V6 is going to go to the mid-axillary line. Kind of like where you guys listen to lung sounds, way under there. And now you have all 10 leads placed. And now at this point, I would ask the patient their age. You'd put in the age and the patient's sex into the monitor, and you have the person hold still, breathe normally, don't move, because again, there's that artifact issue. And you'd hit 12 lead, and it would give you a diagnostic reading of 12 different views of the heart, essentially. I hope this helps you guys with your, your clinical time and out in the field as well.